Hormone therapy is available to individuals 16 years or older in most states and is a partially reversible, non-invasive treatment. The Endocrine Society Clinical Practice Guidelines recommends gender-affirming hormone treatment for adolescents who have undergone proper psychiatric assessment and whose gender dysphoria has persisted for over 1 year. Undergoing hormone therapy for more than 12 months is nearly universally a prerequisite for undergoing gender-affirming surgery for both adults and adolescents, even for mastectomies, a procedure also undergone by cisgendered females for physical health reasons. Currently, no gender-affirming surgery that involves the genital area can be undergone by an individual under the age of 18, and the age guidelines for receiving mastectomies and facial feminization or masculinization vary depending on the state and the hospital. The permanent nature of gender-affirming surgeries is what brings into question whether minors should be able to consent to them, and many professionals have argued in favor of these children's autonomy, stating that gender-affirming surgery can result in improved mental health in transgender individuals due to their physical gender expression being significantly more congruent than it may be with only hormone therapy. The potential mental health benefits of these surgeries are argued to be beneficial enough to allow 16-year-olds to undergo it, partially for the sake of improving their mental well-being. However, shockingly few longitudinal studies have been done on how gender-affirming treatment affects the mental health of transgender adolescents, and even fewer of these studies focus specifically on the outcomes of gender-affirming surgery. To make matters worse, the studies that have been conducted yield different results. A 2020 study conducted by lead scientist Heino Kaltaila and published in the Nordic Journal of Psychiatry found that transgender adolescents with more mental health issues prior to gender-affirming hormone treatment continued to experience those mental health issues during the course of the treatment, whereas transgender adolescents with few to no mental health issues at the baseline fared well during the course of the treatment. A similar study in 2021 was published in the Journal of Sexual Medicine that compared the severity of mental health conditions within adolescents before and after the initiation of gender-affirming hormones. And the results found that the mental health of these individuals did not significantly improve, and their numbers of psychotropic medication prescriptions increased. While these two studies failed to prove that gender-affirming hormone treatment can improve the mental health of transgender adolescents, another study published in 2022 in the scientific journal PLOS One found that adolescents who had undergone gender-affirming hormone therapy in adolescence had lower chances of suicidal actions compared to those who accessed hormone treatment in adulthood. Another study published in JAMA Pediatrics in 2018 found that transmasculine individuals between the ages of 13 and 25 who received mastectomies experienced significantly less chest dysphoria compared to those who did not receive the procedure, therefore showing that gender-affirming surgeries can potentially reduce the feelings of body dysphoria as a consequence of gender dysphoria and the distress associated with it. The wildly low number of studies done on this topic, along with their conflicting results, make it nearly impossible to derive a certain conclusion as to how gender-affirming treatments influence the mental health of transgender adolescents. But at the very least, there are multiple studies that support the idea that these treatments result in increased bodily satisfaction. Not knowing the significance of these treatments in altering transgender adolescents' mental health further convolutes the ethical discussion over whether these individuals should be able to undergo these procedures, since the claimed psychological benefits of these treatments have not been proven in a satisfactory amount of studies, especially those of surgical treatments. Many studies have been conducted in adult populations, and one significant study published in 2021 in the National Institute of Health found that transgender adults who had undergone gender-affirming surgery had significantly lower odds of psychological distress, drug use, and suicidal thoughts or tendencies when compared to transgender adults who had not undergone gender-affirming surgery. These results are consistent with other research regarding influence of gender-affirming surgery on the mental health of transgender adults. Yet due to the lack of research on children and adolescents, it cannot yet be said if these findings are also true for transgender adolescents under the age of 18 who undergo any sort of gender-affirming surgery. If the mental health benefits of gender-affirming surgery in adolescents are not proven by research, then who is to say if that can truly be used as a basis for which to allow adolescents to access these life-altering surgeries? The convoluted nature of this topic led us here at Ethics Point to wonder about the general public's perception of this issue, particularly to identify what they view as the bases for why adolescents should or should not be able to access gender-affirming surgery, to see if there's another avenue beyond age of consent and mental health benefits by which this controversy can be scrutinized. Due to outreach constraints, we primarily surveyed students. half of these students being currently enrolled in high school, and the other half being enrolled in various universities across the country. We asked our participants whether they believed individuals under the age of 18 should be able to undergo gender-confirming surgery, and then presented them with arguments against their own opinion to see how they would respond to them. In total, 40% of participants believed that individuals under the age of 18 should be able to undergo gender-confirming surgery, and 45% believed that they should not. The remaining 15% of participants were unsure. 66.67% of the participants currently under the age of 18 supported gender-conforming surgery for minors, as did 70% of the non-cisgendered participants. From a numerical standpoint, the participants seem nearly perfectly split on this issue, but the written answers provide more nuance, especially for those who answered no or unsure. Many of the participants who answered no supported their answer by saying that individuals under the age of 18 are unable to consent to such a permanent, life-changing procedure, with some participants mentioning that the human frontal lobe is not fully developed until the age of 25. However, a significant number of participants who responded no explained that they would support it in certain circumstances, but not all. Some individuals mentioned that they believe children under the age of 16 should not be able to undergo gender-affirming surgery, but those 16 or older should be able to. Others stated that top surgery, like mastectomies, should be allowed for adolescents, but not bottom surgery, like vaginoplasties and phalloplasties. And multiple stated that hormone treatment should be used by children until the age of 18, while gender-affirming surgery should not be accessible until an individual is 18 or older. Many of those who selected unsure stated that they did not know enough about the risks of these procedures to answer yes. If we consider some of these explanations as yeses under specific circumstances, then the number of participants supporting gender-affirming surgery for minors, even if only specific criteria are met, just barely overtakes those not supporting it. However, it is important to note that the majority of these participants are under the age of 25, with only a few parents and other adults having been surveyed. As a result, these are likely to be biased in favor of a more progressive opinion. A similar survey released to the public in 2020 by the Heritage Foundation found that 57% of the general public oppose allowing transgender minors to access puberty-blocking hormones and gender-affirming surgeries. This survey included a larger age range of participants, which is a likely contributor to the majority opposing these treatments. However, it is also significant to note that this question asked about puberty-blocking hormones and gender-affirming surgeries, rather than just one or the other. In the second segment of our survey, we challenged the participants' initial viewpoints with arguments from the opposing side. For participants who answered no to the initial question, they were informed of the presumed mental health benefits gender-affirming surgery may have for transgender youth, a demographic that experiences a disproportionate amount of mental issues. The participants sympathized with this idea, but suggested alternatives to surgery, such as hormone suppressants, hormone therapy, and more specialized mental health experts, all of which have shown to be beneficial and without the permanency and potential harm of surgery. The second argument presented to what we will call the no group was that unnecessary cosmetic procedures such as breast augmentation and rhinoplasties are available to children under the age of 18, so long as they have parental consent. So why should gender-confirming surgeries be treated differently? Generally, the participants believe that cosmetic procedures like the ones just mentioned above are not as significant as completely changing gender, and so they do not require as much consideration or mental maturity to consent to. A few participants also mentioned that they believed unnecessary cosmetic surgery should also not be allowed for individuals under the age of 18. The final statement presented to the no group asked if they would support gender-affirming surgery for minors if 1. The minor must undergo mental health assessments, and 2. The minor must have been questioning their identity for several years. These two concepts are more general versions of some of the guidelines required by the Massachusetts General Hospital for transgender adults who wish to undergo a form of gender-affirming surgery. Surprisingly, the participants were split in their responses. About half of them believed that these two guidelines were too strict, and that the one requiring mental health assessments was stigmatizing. A quarter of the participants appreciated the strictness of these guidelines and said they would support gender-affirming surgery for minors under these conditions. And the other quarter stood by their initial answer of no, mainly for the reason that they believe minors are not mature enough to consent.